submit your presentation. So we have that is problem now. And then just ATM service. Okay, thank you very much. Miss, can we listen? Can you come for your presentation? Good evening, Group 5, HMIS. Can you have a come for your presentation? It's not a presentation. Are you ready? Okay, when you're there, to put it. Group 3. 5 group 3. Swag ATM. Hello. Who is presenting for ATM? Okay, somebody should go, please. Please, can we listen, please? Somebody should come and present from group 3. Please, a round of applause for them. Group 3, they are ready. Yes. Hello, Ranka. I beg, you need to listen. We want to start presentation. You need something to know. Please, listen. Where's the other mic?
Assalamu alaikum. Good afternoon. you. One house, please. HIV, malaria, and NTD services. This is one intervention. Then the second one is integrating HIV, TB, and malaria, so NTD services. Then harmonize data collection, reporting, across these four partnerships between other agencies like HIV, TB, and malaria. Supportive supervision in those four programs. To facilitate a multi-sectoral partnership to support integration and the sustainable program implementation. That's our number 6. Then number 7, integrated logistic and supply management, which include both distribution and also supply. Then integration of the service delivery on those 4 programs. Thank you very much.
Thank you. Any observation? Just have 30 seconds for observation. Just one. You want to know what came out? Just one person.
Okay, thank you. Okay, thank you for the presentation. I noticed that point 8 is the same with point 7 or 5 or so. You know, you said you should integrate HIV, TB, NTD services. Then now said 8, the integrated services is like a repetition. So that's all. Then your presentation, I think they are all broad things. So maybe you break them into activities when you're doing your AP. So thank you.
Thank you.
Just a quick one in respect to the presentation and the aspect of community awareness as well as the demand creation. The aspect of which network will be aspect of the community engagement. Which network the WDC, CSOs, VDCs, and so on and so forth, so that it will be clear on the path to know the structures that are going to work at the community level. Essentially, they are meant for that. Thank you.
Clear during the AOP activity,
Yes.
activity development.
So thank you very much for the observation.
This is a combination. When you say you want to do demand creation, also aspect, you don't need to mention VDC amount of Okay, you want to respond?
Yes, okay. So thank you very much. I think no problem. So thank you very much for the comment. Actually, the group work is emphasizing on the issue of intervention, not activities. That's why we put it on. But during during AOP, we are going to separate it into activities, and then with the specific objective of each. So thank you very much for your comment.
Thank you very much. HMIS, yeah. Yes.
So thank you. I still remain Kebbi Galagima presenting for Group 5. So my digital health. So we have like 4 interventions we want to prioritize next year. The first one is strengthening the routine health management information, data quality, regular data quality assessment, that is DQA, and data validation, supporting supervision across all 20 LGS and our facilities. Then the second one, build the capacity of healthcare workers on MIE personnel on HMI's digital reporting system, data analysis and use of information for decision making. We also want to improve on ranker service delivery and reporting through strengthening maternal and newborn health interventions. Example, MPCDSR implementation, two-way referral system pathway, and routine performance review and feedback mechanism. Then we also we want to strengthen the digital health system and the reporting infrastructure by expanding our electronic reporting platform, improving internet connectivity and provide ICT equipment to health facilities. That is the area of digitalization and the electronic medical record system that we want to start implementing in our PSCs and our secondary health facility. Thank you.
Thank you very much. Any observations? Reactions? Okay, fine. Next presentation, please.
Service delivery.
Good afternoon, everyone. Permit me to start on the existing protocol of Dr. Abdullah. So I'm going to present group 6 next. 6. Thematic area is service delivery and demand creation. So for ESMA to have to strengthen and maintain the already activated LGA, the remaining 10 MIMI LGAs that have been activated, and to expand RESMAT activation to the remaining 10 LGAs in the state, to institutionalize RESMAT funding within the Kebbi State Contributory Healthcare Management Agency and Basic Care Provision Fund emergency care funding streams to ensure operational sustainability. This has already been adopted by the NHIA, so they've already conducted an assessment and they've looked at some of the facilities that meet the criteria to render CBOM services. So for emergency care, for the first 48 hours is free. Then to conduct structured pre-hospital care and emergency obstetric triage training for CHUs and drivers responders. Next is on immunization, to advocate for the recruitment of additional healthcare workers and build capacity on immunization services across the state. To advocate for the adoption of national minimum wage for all categories of healthcare workers across the state. To provide additional outreach support for RI providers across the state. Additional financial support to the state and LGA team for supportive supervision. Support the SDD maintenance. Most of the available ones are obsolete. So, then to strengthen mobilization and sensitization of caregivers. Next. So for REMCA plus N, to increase community demand for REMCA services by strengthening community engagement, promoting ANC, skill-backed attendance, postnatal care, routine immunization and family planning through WDC, community dialogues, traditional and religious leaders, to enhance the capacity of frontline healthcare workers on BMOM, essential newborn care, integrated management of childhood illnesses, and scale up OTP centers to high-risk facilities and integrated management of acute malnutrition training to other LGAs and health facilities. Capacity building for health workers and institutionalized routine refresher training and mentorship. Strength support supervision and on-the-job training of healthcare workers during supervisory visit. Thank you.
No, don't go. But it has to jump up to that. Any question? Malaria, Kawai. Fine, include that. Thank you very much. Next presentation. Group 1. Group 1. Yan finance ba ba? No, amma ga wancan da su kawo su a ariya ba sa su. Wanda su. Leadership, yes. Group 1. Can somebody come and present for Group 1? Group 1, please. Who is presenting? Yes. Somebody should come and present for Group 1. Who is presenting for Group 1? Director Planning. Can I get presenting for Group 1? Was he presenting? Come and present for Group 1. So back again. Yes. Sarah, please. Leadership, governance and leadership. Go. And human resource.
So, good afternoon all. For we are leadership and governance school. So it entails to strengthen the oversight function mechanism both at the state level and the LGA level to ensure that the funds are allocated to PSCs for service delivery. For service delivery are judiciously utilized. Then we have strong high-level advocacy to the state government for increased funding to health sector in line with the 15% Abuja declaration. And there should be intensified advocacy for full implementation of PSC under one roof as a catalyst for improving health coverage in the state while addressing imbalanced distribution of health personnel between urban and rural PSCs and health facilities. So thank you.
Thank you very much. Any observation, please? Observation? No observation? Thank you very much. Next presentation. Next is health finance. Yes. Can we have somebody from that? And health financing, yes, yes.
Good afternoon.
Good afternoon, sir.
So, my name is Umar Hassan Lampo, presenting thematic area that is financial and HMA. These are the challenges. Number one, delay in releasing of government budget allocation. Then, number two, inadequate funding for PSCs. Then, number three, insufficient skilled health worker, especially in the rural area. Then, low enrollment in the health facility insurance scheme, delay in premium payment, and inadequate funding. That's the challenges. Then, way forward. Number one, ensure timely release of government budget allocation. Then, number two, increase funding to PSC. Then recruitment of train and retain qualified health worker to their facility conducted at Kechema and PSCs. Then expand enrollment through innovation strategies targeting the informal sector. Then subsidize vulnerable groups. Then training collaboration between separate healthcare agencies, Kechema and relevant. Thank you very much for listening.
Thank you very much for your presentation. Any observation, reactions? We have one here. Okay. Thank you.
Thank you very much, Kachema, for your presentation. Actually, this group work for challenges and way forward, we have discussed them during the previous presentation. So you are not expected to start out challenges and way forward. This group work is mainly based on the resolution, what we will write in the community. Thank you.
You're right. trying to bring. Ketema, this component of health financing, it got across all. We have financing 5% for basic healthcare provision for 5% at the primary health development agency. Is also supposed to be in that group. Ketema itself, they're supposed to be in that group. So therefore, yes. So it's important you do a thorough work because let me tell you, the normal jam, after that community sign up tomorrow, our intervention must tailor to what we have agreed. Because all the health sector stakeholders are here in this room. From the local government, traditional, and what have you, CSOs are here, our partners are here. So what we have agreed today and tomorrow, once it is signed, and you know your own is not there. So you now come back middle of the year and begin to think you have intervention you want it to be included. How will it be included? How will you do it? This thing that we have started, we started it last year. If you can see, this year is better than last year. I'm assuring you next year is going to be better than this year. So before you know, please, let's keep on improving. It's also in capacity. Thank you so much. Logistics. Maybe. Okay, so present for the last group. Your group number. Is it the 7th one? Okay, I've not done it. Okay, so BSc stretching, system stretching. Yes. Group 7. Where's the other mic? Just should put it, please.
Hello.
Hi.
Hello. Please, if you can hear me, clap one. If you can hear me, clap once. Clap twice. If you can hear me, clap thrice. Okay, we're together with some of you. Not all. Okay, this is BSc strengthening. Next slide. So in BSc strengthening, the intervention is number one, we'll have governance and accountabilities, which is something as we want leadership get. So strengthen the BSc under our rule for Kebbi State Private Development Agency, the WDCs, community engagement and participation, and increase budget allocations and release for health. Then infrastructure, upgrade L1 facilities to L2 with solar power, water, and mix of human resource. Mix of human resource, SBS, pharmacy, lab technician, and all other persons that need in the facilities. Then health commodities, ensure availability of essential drugs and laboratory commodities. Next slide. Then access and equity, increase utilization of BSc services and reduce barrier of distance, cost, and poor quality, especially for rural and outreach communities. When we talk about the cost, that means to ensure enrollment of the people. Also the distance, we're also looking at the way that the facility can be situated in close by area clusters that can serve a lot of people within that clusters. So thank you, because there's a lot of explanation, but let me stop here.
Thank you very much for your presentation. Can we have actions, observation, question for this presentation? Hello? If no, your presentation, is it ready? Okay, so who is presenting for the group? So you're welcome.
Assalamu alaikum. Good afternoon, everyone. I remain Abakar Musa with the presentation on the thematic area of logistics and supply for Group 4. Next. Then, under the thematic area, we have the supply of kits, which are the HIV kits. Supply of free HIV test kits to increase awareness on free, voluntary counseling and testing, including marriage testing among the couple, and create demand within the community in order to avoid the spread of HIV/AIDS. Under the immunization, we have to support the outreach services and reduce the issue of mobility and reduce zero dogs among children 0 to 23 months of age. On the PHCs/health system strengthening, to liaise with KECHEMA and DMS to increase the supply of free commodities for the community, for the continuity of our services and the services delivery fund. Thank you.
Thank you very much for your presentation. Any comments? Any comments? Yes. We have one for the group.
Thank you for logistics and supply. Yesterday we saw the National Health Survey, and then our drug, it was so low for our drugs. I was expecting you to mention something about maybe advocacy so that we have essential drugs in the facilities. And also for immunization, I was also expecting to see maybe things about vaccines, transport, the LGAs, support them, and think about the vaccines logistics, not just supporting outreach services, the health of place logistics. So thank you.
Thank you very much for the observation and for noting the observation. Okay. Please, can we
if I said Aranga Amus, that time there. Netia Aranga Amus, that time there. Netia is a Piajo. Aranga Amusu. Aranga Amusu. Aranga Amusu. Aranga Amusu. Aranga Amusu. So yeah, it's a Haga.
so we can take our seats? Okay. For the past 2 days, yesterday and today, we have been making presentations, observations. In the presentation we have challenges, way forward, and everything. We have done our group work today, and in that group work we have a presentation. We have seen some of the solutions in all our thematic areas. Okay, fine. We have come to the end of this. Our community. Now, start from here. Can we have, let's just say, one person from development partners, one person from the CSOs, one person from the local government, and one person from the Ministry of Health, either ministry or agency, anyone, just one person. We want to have a team of 5 people that will look at all the presentation we had for today, the last 7 thematic areas, and fine-tune them, put them in a proper shape, so that tomorrow early morning we are going to present them as for commissioner to sign at the starting point of our 2027 AO. If you want to volunteer, you can volunteer. One person from the Yes, I'm not seeing hands. Don't worry, Eva. Don't worry, God is a man. Okay, yes. Can we have your volunteer, please? I will nominate you. I will nominate. You don't worry the partners. Don't worry the partners. Okay, thank you very much. Most one partner that you support, you join the group. Local government, I need a volunteer. Chairman, Council Committee? Fine, thank you. We have two. Then, from the CSOs. And that's this voice. Benan? Okay. The states. That work starts after this program. That's how we are actually by single. Chairman, fine. I want to talk about ego. Program officers, I see my posting in our groups. Those are the documents that will the presentations are there. We have updates. Based on our comments and issues we raised, the last AOP2 of last year, so a lot of updates were done. Therefore, we do not necessarily have resources for that update. That is why I sent you a link of video that was done as a summary of all the updates in the fashion. And go through those documents. I also want to read you see the updates. If we have if you are in one, you will have one information. That somebody will not ask and you will respond. So therefore, go through it. Our AOP is around the corner. In fact, we have even started. From here, we have already gotten our what's it called? Strategic interventions. The OOP roadmap will also be shared in those groups I shared the slides. The roadmap, the deadline for the 2027 AOP development is 30th September 2026.
In buɗe
Samsung hotspot ɗinka.
hotspot ɗina?
Samsung buɗe ki. Ina ga yanzu. Yanzu.
To ai damar shi da network ɗin Infinix ɗaya a wanda shi.
Okay. Na gane.
Then connect it. And use
Kwanta min da ita.
the app. You can use the username and password to open the laptop. Give them one post, show them.
Okay, ba automatic abin nan.
Automatic, kai automatic.
Wai akwai auto retest ko wurin ga.
Mun ga portrait, muke son wasu son wahala na.
The 5 days, the way we have started last year, it is not what we go to school to review or for evaluation. That's what we begin to develop activities. This one, I'm not talking to the program officers. State program officers. Please, after this update, begin to enter your 2027 activities into that light. It's a light. Start today. That's right. Remember, if you want to change it tomorrow, it's easy to change it. Because we have to finalize, we enter 2026 to start the implementation. You see one for two intervention that you want to do from national. Then you cannot get proposed from national. We just if your activity not get intervention. If your activity comes to me, or maybe you should come and see you, you have activities that you activity. I can only call you and tell you, please, take activity in the because I can see your name on the phone number and that for you to take your activities. Liaise with the relevant program officer you're working with. Sit with him. None of the partner has username. So we should know all the activities we want to do, conduct instance. That program officer should be the one to enter the activity and make the cost. We get that. Now, for the program, for the AOP managers, we have about 4 AOP managers. At the primary health development agency, we have our sisters group. That is one. At the table and group, we got them together. Yes, that is what we say. At the Ministry of Health, we divided the Ministry of Health into two because of the volume of the units public health pass. Yes, they have their one. They are together with them. Yes. So public health, they have their own AOP manager. That is available. See here. So AOP manager also has a password and username that can give all the activities and just on that organization. We have the one that is Ministry of Health. I have the username password. So we have issue with the course item. Last thing we are not able to sit together and define all the course items. So this year we are going to review that of last year. We must have a day to sit together all the AOP managers and review last year course item. The one we need to add money, the one that we need to reduce money. Because last year they will include some of the item costs. It's not good enough. The amount we put is so high. Even at the national level procurement cannot, that money is huge. So we review it and agree and enter. None of the program officers can edit or change cost item. For the program officers, they only click whatever they put there, they will see the amount will drop. You only put number of days, maybe amount, number of activities, but you cannot put amount of that activity. That is the limitation. Likewise, the Kebbi managers also have their own limitation. They cannot get any activity. They cannot get any activity. They can only do and ensure it enters effort. Then there is issue they will follow for the others. You also have issue. This one is general. Performance framework. In that area, more than 80% of our activity last year, that particular component is not completed. It has actually been a serious concern. So this same place, that is one of the issues I raised, that we need to sit in the room and look at the challenges of last year so that we can improve this year. Don't support, usually do it. I'm saying all this in front of all the partners. If you have any support to support us in these three activities, or the first two I mentioned, please and please discuss with the organization. Go back. One, PSC AOP development that we need to do it at the local government level. We bring all the PSC in charges together and do this. If you have support for refreshments, thank you. You're welcome. If your support is for transportation, thank you. You're welcome. If you want to take one, fine. If you want to take one, if you want to take part, in fact, even if you are supporting 10 local government and you want to support only 10 local government, please and please let us know. Then we can now say the remaining 10 other partners can support that and that. Do we get that? So for the partners, please, if you have any support in this activity, please, you are welcome. And the one I made mention of bringing on the MID officers and the program officers and bringing them so that we can have the updates of that life is also important. Even if it is a day or so, please and please, I want us to have the feedback between now and next activity so that brand new again and see how it goes. You want to get my contact number or the item plan or the service of hand so that if you have any support, please let us support. If it means we to write to the organization because the support is available, we will write to the organization, then you can give us that support. Thank you so much. At this point, we go for prayers. Is the lunch ready? Lunch is ready. So, can we have, we usually have 1 hour for the lunch and prayer, isn't it? So for this time around, we are going to take 40 minutes. We go and take our lunch, we take our tea break, lunch and prayers. Is that okay? What's time now? 2 minutes to 4. So can we take our lunch and tea break for 40 minutes? Thank you very much for your patience. So for tomorrow, please. For tomorrow, please, we are not closing for 10 announcements so that I will finish my talk. You get it? For tomorrow, we are going to start as items because we expect about 10 commissioners to be here with us for the signing of our community. And we need to present that community as early as possible for those to agree before they arrive. Because we are going to change some of the curative match some statements together because there are some I hear in the district and I hear organization in another component where we have service delivery and what have you. We are going to look at them holistically and match them together. Some of them that we can match together and we need to represent all of us and agree the changes to be made. Together. So can we be there tomorrow night? Please tomorrow is the last day and we will necessarily be able to after we want to close before 2 months because the high table of tomorrow, once that contract is signed, that contract is community is signed, I am telling you, you will not come back to this. So it's only we that will come back to you. So please we go and pray and take our lunch and come back after 15 minutes.
Yeah.